Mike to tell you for Thibodaux Regional Medical Center. I'm here with Orthopedic Surgeon Dr. Neil Maki. Neil, thanks so much for joining us today. We're talking about anterior hip replacement. And so kind of give a little bit of background for a patient that's looking to have this done, some of the techniques that you use to help them.
When you look at the hip replacement, why do you do a hip replacement? Well, most of the time it's elderly patients that have progressive arthritis problems and then have lots of pain and then problems with functions. Traditionally, the procedure has been done through what we refer to as a posterior surgical approach. Mike, in other words, we're cutting along the side and then towards the back buttock area, and that gives us a very wide exposure to both the socket and the thigh bone. So when we're talking about the anterior approach, which you asked me about, that's been an innovative approach for doing the hip replacement. It's an approach which splits between muscle planes and does not detach the muscles, does not detach the tendons, and it's done through smaller incisions. Generally, the rehabilitation period is shorter.
A little bit of kind of explanation on if you would go with a socket, ceramic, or say metal.
In fact, I brought these little models here, Mike, to show you. This will be the socket, and this will be the plastic that interposes between the metal. This metal here has what we call a porous coating on it, and actually grows into the bone. So sometimes, most of the time, we'll use that in order to fix the prosthesis into the bone, or else we'll use a bone cement. Now this will have a plastic in between it, and the commonly we use is a stainless steel head on a femoral stem. And again, the stem has this special coating on where bone grows into it, which is favored over using the bone cement, and then we'll have the prosthesis that articulates like this. If you want to go on for that, you can use what we refer to as a ceramic. The ceramic in lab testing is so good right now that it's probably more the Cadillac standard.
So
maybe for that 30-year-old, it's maybe the wave of the future, yeah.
For Dr. Neil Maki, this is Mike Detillier for Thibodaux Regional Medical Center.